5 on your mental health now. State lawmakers are pushing to advance a bill aimed at protecting maternal mental health.
So the legislation would allow midwife services to be covered by MassHealth, remove barriers to operate birth centers in Massachusetts, and expand access to lactation support and require postpartum depression screenings for new parents during visits to the pediatrician. Here to talk more about this is Dr. Alice Connors-Kellgren from Tufts Medical Center. Good to see you, doctor.
Nice to see you.
Yes, thanks for being here. So if you would, tell us more about these screenings. What types of questions would a doctor be asking?
Yeah, so the purpose of these screenings is to identify whether someone is experiencing any symptoms of depression and how severe these symptoms are. So screenings typically ask about mood, sleep, appetite, changes in behavior, changes in thinking, and unusual worries or anxiety, as well as how often or strongly someone is experiencing these. And then the postpartum screenings in particular are going to be asking also about experiences related to being a new parent, such as feelings towards the baby or feelings about oneself as a parent.
So, doctor, some people don't want to share honestly that information. How can you encourage them to be honest with their answers?
Yeah, so we can't ensure that someone's going to be honest with their answers, but doctors are trained to create a sense of safety with their patients to really help them be honest and help them understand that they are answering this to get help, not to be punished in any way.
Okay, and sponsors of this legislation, they really want these screenings to be routine. My understanding is disparities have been seen in who gets these types of screenings. So can you elaborate on the importance of that?
Absolutely. So part of the aim of this legislation is to reduce the disparity in maternal morbidity that exists between Black women and other women of color and white women. And so, part of the reason for that is that Black women are not as closely monitored and they don't receive the same kind of care during their pregnancies and the postpartum period as white women do. And so by requiring these to be routine, the hope is that Black women and white women and other women of color will be getting the same kind of attention when it comes to understanding what their experience is.
Yes, indeed. Dr. Connors-Kellgren, thank you so much for your time. Stay well, doctor. Thank you.
Yeah, thank you.